Hello, thank you for joining us. I'm Mariekarl Vilceus-Talty, President and CEO for the Partnership of Maternal and Child Health of Northern New Jersey. Welcome to our very first episode of Partnership Live. Each month, I'll be joined by an esteemed guest across Northern New Jersey discussing the health issues that impact our communities and how we are changing the landscape. I'm excited about it, and I hope that you'll tune in. So today, in honor of Maternal Health Awareness Day, coming up on January 23rd, we will be discussing with our member hospitals how they're honoring the day and what initiatives they're doing and putting forward to improve maternal health outcomes. Joining me today, we have Dr. Diana Contreras, System Medical Officer for Obstetrics and Gynecology and Women's Health Service Line at Atlantic Health. Welcome, Diana. We have Dr. Marilyn McArthur, an OBGYN at Cooperman Barnabas Medical Center. Welcome. Valerie French, Director of Nursing for MCH, and Marilyn Garrity, Nurse Manager for Labor and Delivery and Pediatrics at Englewood Health. Welcome, ladies. Shirley McDuffie, Nurse Midwife at Trinitas Regional Medical Center. And last but not least, Dr. Lisa Gittens-Williams, who is the professor at Rutgers, New Jersey Medical School and Director of Obstetric Services at Rutgers, New Jersey Medical School, University Hospital. Thank you so much for joining us on this really important week, or we can say really important month, because we know that maternal health awareness is something that is very dear to us as medical providers and very important to the community. So we are fortunate enough to be in New Jersey, who started Maternal Health Awareness Week or Day, January 23rd in 2018, to help bring awareness to the urgency of the maternal mortality crisis that had been happening in the United States and how we change the paradigm and the landscape. Unfortunately, we know that the US is the only developed country that the maternal mortality rate is rising, and 60% of those deaths are preventable. So getting together and talking about how we can change the paradigm, especially for our Black and Brown women who are really having a perilous journey when it comes to childbirth, because we know that in New Jersey, we as Black women, myself included, Black and Brown women are 7 times likely to die in childbirth than our white counterparts. And so many of our member hospitals are really changing that landscape and changing the paradigm. So we wanted to bring to you today what is happening in those member hospitals. So we'd like to start talking about how are you commemorating the Special Awareness Day month that we have, and what kind of events and educational opportunities do you have for the constituents that partake in your hospital system? Dr. Contreras, let's start with you.
So I want to thank you very much for inviting us and allowing me to speak to some of the things that the Atlantic Health System is doing in our catchment area and for our patients. We recognize that this is not just a day, it isn't just a month, it is what we do every single day, 24/7, to make sure that all our moms are getting the care that they absolutely need. We've recognized that part of the issue is how do we empower our patients and give them agency to speak forward. It is critical that we have equity in healthcare. And so we have addressed the idea of equity in healthcare related to education. And we have branded an app of our own, which we give to our patients at the time at which they enroll in our system, for which the educational information is sent to them on their phone every week. And so that they can have 24/7 access. Sometimes you hesitate to call your doc at 2 o'clock in the morning and you have a question. And what we've learned in this time of misinformation on digital is that people need a reliable source to get their information. So our information is provided both in English and in Spanish. It's all WHO and ACOG approved. And we feel that it's critically important that 24/7, we have our patients able to ask questions and really get information that's reliable. So that's one way in which we're doing and really am trying to empower women to have the information at their fingertips.
That's definitely really innovative. Like you said, sometimes you think, this is really no big deal. I don't want to call the doctor. And then you can just get right on your phone and connect and get the right answers and not misinformation. That's a wonderful idea. Will you share that app information with us later, and then we'll send that out to everyone?
Sure, happy to share, what we're doing.
Okay, great. Shirley, what's happening over there in Trinitas?
Well, what I can say is that at Trinitas, we're not just commemorating this as a January 23rd. We actually engage with our patients every day. So every week, every day is maternal awareness. We're very fortunate in my midwifery group that we have one of the lowest primary C-section rates in New Jersey. We also have a very diverse midwifery group among the 6 of us that manage the patients. So that really helps to meet the need of the community that we serve.
It is really important that when you go into any institution, especially when you're getting healthcare, to see someone that looks like you, speaks the same language, brings that anxiety level way down. So we'll definitely be able to let all of our member hospitals know what is going on there. And thank you for that. So you have a Creole speaking midwife. Certified. Absolutely. There are many Creole speaking people, so that is great to put people at ease. Shirley and Valerie over at Englewood Health. I know you guys are doing quite a bit of things over the year. What are you guys doing?
Hi, I think, as Shirley said, we look at this as an ongoing, not just a specific day or a week or a month. We look at educating our patients and making sure that they know what signs and symptoms to look for after discharge, to make sure that they do contact their physicians or their nursing team. We do follow-up phone calls regarding breastfeeding to make sure that the moms know what they're doing after they go home with the breastfeeding of their baby. We also are very focused on the initiatives from the Joint Commission looking at reducing maternal morbidity and mortality related to hypertension and hemorrhage. So we give a lot of information to the patients after discharge. And I think in a little bit, Marielle will talk a little more about what we've done for our quantitative blood loss initiative. That's been very big. We had a really nice drills day session. And Marielle, do you want to speak a little bit to that?
Good afternoon, everybody. So as Valerie said, and as Shirley said, we do it every day within Englewood Health. I think we start from the moments our patients walk in the door upon education and what's going on with them. And, we treat the person and, any issues that they're having, from the start to the end and even beyond. We want to make sure that the patients, whether they, they're hypertensive or, they have a chance for hemorrhage and stuff like that. So last year was a very big year for us. We took our organization from EBL to QBL, and we did drills days and quantitative blood loss education for everyone. We did it for our labor and delivery team as well as our mother baby, which is our postpartum. It was wonderful because we had interdisciplinary team members, and they got to see where you estimate the blood loss and no one really knows how much it is. You think it's 200 cc's and it's really 2,000, or you think it's 2,000 and it's really 200. And we worked with a lot of jelly, a lot of I was
gonna say complete with Welch's grape jelly.
Yeah, Welch's grape jelly.
Best clots ever.
That Val had in a refrigerator were really helpful. But it really showed everybody, especially on our postpartum units, because labor and delivery, unfortunately, we see a lot more of this. And the moms and, on postpartum, it can happen anywhere. So the education was really priceless. And the nurses, and we had doctors come, and they just said how hands-on it was, and the visualization. And we had them weighing everything. And then we also had our first drills day, where we incorporated 6 different drills. It was 4-hour sessions, and we did it on like a 12-hour day, like we broke it up. And we had them rotate through shoulder dystocia, massive hemorrhage, preeclampsia, code white, I think we had the malignant hyperthermia, we had preeclampsia, I think I said all that. So 6 different drills that they rotated through, and they actually did scenarios. And what really was great was we had everyone participate. So we had the secretaries, the patient care associates, the doctors, and the doctors actually came back and said they didn't realize how much the nurses did, or how much the secretaries' roles were, and how important it all was. So it really, the education just brought so much more awareness to what we do at Englewood.
And I think we focused on staff education, but I think it was important that we gave the staff the education so that they knew that this was important for them to share with the patients. I think that was the whole point of this, that, you know, teaching the staff and giving them all of this information to share with the patient at discharge was important.
And we continue to do that on a daily basis. Anything the nurses need, we always make sure they have the education to bring to the patients. So even after discharge, the patients are aware of the signs and symptoms of when to call the doctor.
Exactly. And as ACAR has reported, 60% of these deaths are preventable. So being able to work as a team, making sure you're a well-oiled machine is what is going to be, you know, one of the deciding factors. Making sure that awareness is top of mind, knowing what to do. Dr. McArthur, what's happening in Cooperman, Barnabas Health? Oh, you're on mute.
I have to get used to saying Cooperman, but yes, like everybody else, every day is maternal health awareness for us. I'm going to say it now, #123, every woman, every hospital, every time. And with COVID, it's upended a lot of the things that we would normally do. I have to say one of the initiatives that we've been working on for the past several years is decreasing our primary C-section rate. And I'm happy that it seems to be they're tallying up the last things, but we're on track to meet the state's guideline. And this is significant since we do about 6,500 deliveries a year. On a smaller note, in our clinic, we will be celebrating the day. We're planning to have a luncheon for staff and the residents to address the issue of healthcare awareness, and also to focus on 2 new initiatives that we have going. One is the perinatal mood and anxiety disorder center that started up now at Cooperman Barnabas. And the second is looking at, we've just recently received a grant for a centering pregnancy program. So it'll be starting to introduce the resident staff to that. For our patients, there will be informational and gift bags where the focus of those will be COVID vaccination, the centering concept, and more information about our perinatal mood and anxiety disorder center. There's been a big interest in focusing on the mental health, dealing with COVID. For everybody, there's anxiety, and certainly postpartum depression is nothing new. It's a subject that everybody needs to confront. So the focus will be on that. And we'll also have a raffle in appreciation of all the residents' efforts in keeping the section rate down for a gift for them. So that's the specifics of what we're doing for this week coming up.
That's excellent. And you know that especially the mental health portion really does just thread very nicely with the legislation that's out mandating the perinatal mood disorder screening for all of the patients that have delivered, because it's just so important, especially now with COVID being isolated, feeling that anxiety that we have, our patients have someone to speak to and to get the help that they need. So thank you so much for sharing that. Dr. Lisa Gittens-Williams.
Thank you for inviting me. So we use the Maternal Health Awareness Day as an opportunity threefold. First, we use it as a way to evaluate our metrics. And so University Hospital has been one of the hospitals that has repeatedly met the national metric for nulliparous term singleton vertex rates, and we've been nationally recognized for that. So we make sure that we're on point with that metric again. We also look at our VBAC rates, and we're one of the highest VBAC rates in the state, and we look for opportunities to improve that and continue to educate our moms on the option for vaginal birth after cesarean section. And then we also look at our hemorrhage and hypertension bundles, assuring that we're following the AIM and the Joint Commission requirements. And we have fully implemented all of those metrics and those protocols within our organization. And then we use the day to educate patients and providers. So for tomorrow, we have a patient-centered educational program that will be available via Zoom. And for this, for patients and also for their family members, we're hoping to talk to them about, number one, post-birth warning signs, and then we're talking to them about birth justice. We think this is really important as we look at racial disparities. What is birth justice? And we're partnering with a community partner, Just Birth Space, to talk to our patients about birth justice and to talk to them also about virtual support platform that they offer. Also included in that program, we'll be launching and promoting the Maternal Experience Survey. This is an initiative from the Prematurity Prevention Initiative, partnered with the NAACP, asking women about their birth experience. We think it's really important to hear what women say about their stay at our hospital, in the emergency room, and in the ambulatory care setting. So we'll be talking with our patients about that. So that program will be available via Zoom by registration. It's going to be administered through Rutgers Project ECHO, with whom we have partnered in this initiative. And it'll also be administered by our preventive medicine and internal medicine residents who are training in maternal health. So we have a unique opportunity to have an interdisciplinary group to educate our patients and their family. And then on the provider end, we're going to have a program on the 26th, so that will be next week on Wednesday. At that program, we'll have Senator Cory Booker speak to us about maternal health. If any of you attended the National Summit at the White House, and he was very passionate about maternal health, and his contributions have been incredible to us. And we will also be having a program that has been completed by ACOG District 3, which is New Jersey, Pennsylvania, Delaware, and the Dominican Republic. At that program, which will be virtual and available to all, we'll be talking about improving immunization in women. And really, there's no time like today, yesterday, this past month, for which we've all been going through, to talk about how we can improve immunizations in women. But we're looking at it from the standpoint of ethics and also in engaging the community. So we have 2 experts, and on that platform, a public health expert and then an ethics expert engaging in dialogue about how to improve that. So those are our planned activities, and I'm really looking forward to them. I hope everyone will join.
Absolutely. Definitely send us that information so we can put it on our website to make sure that that information is out there and people join. You had a little segue where you talked about the community. Dr. Contreras, can you talk to us, share with us about how you're partnering with the community? And I know that you're doing this on a daily basis to create awareness and a sustainable relationship of trust with the community.
So we feel that a really sustainable relationship has to do with transparency, openness, and really creating an environment of listening. And so one thing that we have created in our institutions, and this is across our system, so all of our maternity hospitals participate in all of our programs, is we have created what's called a virtual postpartum visit. So we bring your postpartum visit to your home. How do we do that? We recognize that during this incredibly difficult time, patients were afraid to leave the hospital and they were afraid to come to the hospital. It was a very difficult time for people, and they left incredibly quickly. And so our great concern was, are women getting enough of the education? Are we hearing them? Are we addressing their issues? And the pediatricians continue to see their babies, but women were discharged in less than 24 hours or 24 hours, and then were being seen 6 weeks later. What we instituted was a virtual visit that was done 2 to 3 days after they were discharged. Prior to discharge, you got an appointment. We would have the appointment set up, and we had a team of folks, nurse, a social worker, a lactation consultant, and they would visit with you at a specific time. And what we found was really pretty amazing. We would visit with them in their living room with whoever else was in their family. And the amount of information that was shared and the amount of information that we acquired to help patients get better care was really pretty incredible. So by traveling to people's homes virtually, we really created a tremendous link with our community because we were there for them. And we really put our hugging arms around them saying, you're not alone here, we're here with you. And I think one thing that happens is that women can feel very alone. Much of the attention is placed on the baby. When women go home, everybody says, how's the baby? How's this? How's the breastfeeding? Everybody forgets about mom. Well, we don't want to forget about mom. Mom is really important. And so we base most of our questions and our conversation is really about mom, how you doing? Are you okay? Are you blue? Are you depressed? Are you eating? How are things at home? Are you getting any help? And so we really focus on mom because we think that that's really important and that it has to happen if we're going to have a healthy mom and a healthy baby.
That's
So
such a
we
great
really
idea.
reached out to our community.
Yeah, that's such a great idea, building a relationship of trust, expanding. This is really a great expansion on the patient safety calls that I know a lot of the hospitals are doing 2 to 3 days after. So this is a really like safety call 3.0. Very, very nice idea. I'm sure, sharing amongst ourselves, somebody else will call you and ask you how you did that. So we can make sure all the other hospitals are able to do that. Shirley?
Yes.
How are you? So at Trinitas, how are you building that trusting relationship with the patients?
Well, actually, the trusting relationship starts antepartum. Myself, as well as the rest of my sisters that are midwives with me, we see the patients antepartumly. And when these patients come to the hospital, they've seen us in the clinic and they see me in labor and delivery. Oh, Miss Shirley, you're going to be there when I have my baby? And many of I've been doing this for 29 years. So many of these mothers I have delivered, their sisters, cousins. I've been like the family midwife. So it just really helps the patient to see us in labor with them, delivering their babies, seeing them postpartum, contacting many of them. I do give them my cell phone number. I do check on them prior to a 2-week visit or a 6-week visit. And so that type of continuity is so important for this community of patients that we serve.
Absolutely. Absolutely. And I'm sure, Dr. McArthur, you said that you're starting a centering pregnancy program. I'm sure that in addition to other things that you're doing is really building a trusting relationship with the community.
Yes, we expect that it will do that. It hasn't started yet, but the concept of that will be group pregnancy care versus the one-on-one visit. It'll be a 90-minute to 2-hour visit where the patient gets involved in self-care. So they will actually learn how to take their blood pressure, do their urines, do their weight and chart in their charting. And the idea will be to get 8 to 10 people, either similar gestational age or similar medical problem. If you're a hypertensive, you're a diabetic, and in that way there would be discussion. You will see that you're not alone. And the whole idea is one of the things that we know as far as maternal health awareness, the prematurity rate for Blacks are much higher. And studies have shown that using the centering model, they're able to reduce the racial disparity in prematurity. So the concept will be to get them into their groups. And what they found is people make their friendships, the trust is built there, and these friendships continue beyond just the pregnancy. So that's what we're working forward to move ahead on.
Oh, wonderful, wonderful. Mariellen and Valerie, I know that you said that you were doing a lot of team training, a lot of drills and working as a team. I'm sure that the patients can definitely see that, and that even builds more trust. What else is happening at Englewood Health? You're on mute.
There we go. Okay. We have a perinatal loss support group, which Mary Ellen actually leads, and it meets once a month. And we have patients who have experienced losses, not just local, but sometimes they've even told their friends about it. And we've had people from out of state. I think that one of the only good things that's come out of COVID is the ability to have some of these virtual sessions that people can join without having to come into the facility. So their families can join, parents, grandparents, whoever can also join. One of the other things that we've done as far as education is that we are in the process, it's not quite finished yet, of filming a discharge instruction class for the patients, and the nursing staff on the mother-baby unit are actually doing the video for that. So as Shirley said, they'll see that person here while they're taking care of them, and then, oh, that's person on the video, she was my nurse. So I think that'll be kind of cool, and it'll also engage the community with us a little bit. I don't know, Marilyn, was there anything else that?
Yeah, no, as Valerie said, it's been, with COVID the past 2 years, it's been really hard. And I think the video that they're doing on Mother Baby will be essential, to giving them more education when they go home and knowing that they're not alone. And, there's a lot of questions that they have when they do leave. And sometimes they don't want to call the doctor's office. And it may just be, something that could be on the video, but seeing those familiar faces go over all of that education. And, unfortunate events do happen when we do have losses. And I think, we've had the support group for years, but I think taking it to a new level and putting it virtually has, as Valerie said, really given the chance of a lot of people. What we're seeing is there's a lot more people that are joining. And, they can join anonymously. They don't have to, no video. We've also done a Remembrance Day, and we do that every year for those that have had any losses. I mean, it could have been, a very early miscarriage to, all the way up to, a full delivery
Loss.
and a full loss, the delivery loss. And so, or anywhere in between. And everybody is so thoughtful and, helps each other. And it's just so wonderful to, it's such a sad time, but it's wonderful in the way that all of them are there for each other. And, and it's not just once a month, it's, they can reach out at any given time to all of us. So, and that
It sounds like what Dr. Contreras had said earlier about putting the warm hug, your arms around the patient, letting them know that they're connected. What about Dr. Lisa Gittens-Williams? Oh, you're on mute also.
Yeah, so really to empower and support our patients, we launched and we've been promoting the Hear Her campaign from the Centers for Disease Control and Prevention. So we make sure that all of our patients have that information. It's downloadable from the CDC website. And we started a campaign last Maternal Health Awareness Day, and we continue that now, where every patient gets the information, and they also get information to give to their families, letting them know that if they come to our organization, we will hear them, we will listen to their complaints, and we will put them first. This campaign specifically speaks to racial disparities. So the graphics on all of the documents are extremely culturally diverse. And so we're able to give that to all of our patients, also in Spanish. So we promoted that throughout our organization, as well as training providers to also listen to moms. And so that's how we're engaging with our moms and with our family and families, and also with our community. And we also are engaging with our community partners. And so one of our newer initiatives is we have a program for moms that have babies with Down syndrome called Exceptional Families. We found that there were a subset of families that had elected to carry the pregnancy to term and now have a beautiful baby, but they didn't have a lot of support, particularly in this COVID environment. And several of the families were Spanish speaking, so they also did not know how to connect to others. So through this really wonderful program called Exceptional Families, we've put families together. They're now friends, they talk, they meet with our social worker, and they are able to avail themselves of the resources in the community to make sure that their children and their families get the best support. And so we've also engaged with our community partners. And so I think when you need something, if you ask or you pray for it strongly enough, it falls from the sky. And so you may be aware of the Prematurity initiative, the Prematurity Foundation initiative, where blood pressure cuffs have been given out in the COVID pandemic. Earlier in the pandemic, we were trying to give these machines through the generous donation from our partners to our patients so that they could have virtual visits. But we also recognize a need in many of our moms that have hypertension diagnosed at the time of delivery. So their pregnancy is fine, but in that intrapartum period, they have hypertension. And now they need close follow-up, or they have preeclampsia or preeclampsia with severe features. And now they need close postpartum follow-up of their blood pressure. But they're going home with a new baby, maybe prescriptions to pick up at the pharmacy. And now we're asking them to go buy a blood pressure machine in a store where no one wants to go to because it's COVID.
Right.
So we started actually giving them the blood pressure machines at the time of discharge, counseling them on how to use it, and then having telehealth follow-up. And we found that that has really been a tremendous initiative because we're able to pick up on hypertension early at home, or the patients are able to come back and let us know if they have high blood pressure. And it's also improved their postpartum follow-up. So through the generous donation of community partners and really asking for that, we've been able to use community partnerships to improve maternal health.
That is really excellent. There's so many great things going on in all of your member hospitals. I know we're running up on time, but I have one last question, especially now that maternal health awareness and the abhorrent statistics for Black and Brown women are out in the forefront and people are talking about it. And you see it on Facebook and Twitter and Instagram that women are afraid to speak up. You know, it's not only the quantitative information, but it's the qualitative information that we get that people are not feeling respected or afraid to speak up. How is your hospital and how are you empowering the patients to be their own advocate if something is going amiss, that they are not afraid to speak up and that we can start decreasing these numbers of preventable, more maternal mortality events? Shirley? What's happening over in Trinitas? How are you empowering the patients to speak up?
Again, I want to reiterate, like I said before, patients, they do form a bond with the midwives here. And I find, not to take anything away from my doctors, but I feel that the patients will come to us quicker than they will our doctors. And if it's something that I can't get resolved for them, then I go to the group. We have an OB meeting, or we can call it at any time with our doctors and we can address the issues at hand. And I also do want to say to the Dr. McArthur, just to put a point in about centering pregnancy. I've been involved in that a lot and it works. And that was pioneered by a certified nurse midwife from Yale.
Yes.
That program, it's a very good program. You're going to have a lot of success with that.
Mm-hmm, mm-hmm. Yes, absolutely. And one of the good things with the partnership is that, we are definitely conveners. We bring people together, make sure the information is shared throughout the continuum. And we had the opportunity to work with Dr. McArthur and Lillian Morales to partner them and get them information from St. Joe's, who has a centering pregnancy program, so they can go over to St. Joe's and see how it works and see all the successes. And I do believe that that's going very well. And since we're talking about Cooperman Barnabas, Dr. McArthur, how are you empowering your patients to speak up?
I guess my thing about speaking up is I think it starts with your office visits with your patients. Too many times the model of medicine is moving to the big factories, the big group, and patients are just passed through because you have to see so many patients. Gone are the good old days of a doctor-patient relationship. And I think conversation, and I mean two-way, not me just telling them stuff, but if you get to know your patients, you get to have the conversations, you can set realistic expectations. Because I think most of the times when you have things that have happened that are an issue for somebody, it's because there wasn't conversation before time. If you didn't understand what an induction was, then you're like, why are they doing this to me? So my whole thing is working with the residents and working with the other staff. This is something that's harder to get out to the doctors in the community, but when you have residents, these are the future doctors. Work on conversation skills, working on making sure the patient is comfortable. That way the patient has a relationship. They will ask you anything, tell you anything, but work on relationship. It's conversation. Communication can solve a lot of problems.
Absolutely. Absolutely agree. Dr. Contreras?
So very interesting conversation that everybody's been having, because I think everybody's been attacking the same problem in a lot of different ways. And I do think the point that Dr. McArthur just brought up about communication is critical. So one of the ways that we try to address communication is that we recognize that for most patients who are pregnant or thinking about pregnancy, they're a different generation and they think about things differently and they communicate differently. So we've moved a little bit more on a digital platform to empower patients to have agency. So one of the areas in which we've done this as well is with what's called Bluetooth enabled remote patient monitoring for blood pressure. We give Bluetooth enabled blood pressure cuffs to all of our patients if you fall into a certain criteria that we have that has been established by ACOG. So we try to make sure that this is equitable. It is not about a physician making a decision, do I think this patient will participate or not? Does she have the wherewithal to do it? It's if the algorithm says that you have the criteria, we put you into the program. And we offer this program to our patients for free. And we teach them how to put the blood pressure cuff on, and the blood pressure measurements get monitored. And so we're using a whole digital way of empowering women. And what's fascinating to me is that we have been able to show that we do it both in English and in Spanish. Patients are very interested in this. And the idea that women can't get it, they can't figure out how to do this, that's totally wrong. All we have to do is give them the tools and have them understand. Most women, and I would say all women who are pregnant, want to have the most successful pregnancy possible. They want to bring healthy children into this world. They themselves want to be healthy. And what we need to do is partner with them, communicate with them, give them the tools that they need in this crazy day and age of everything changing so rapidly, so that they can be part of the owners of their own healthcare. And that's really where I think the communication is important and some of the things that we're trying to do.
Absolutely. Communication is definitely key. Being a labor and delivery nurse for many years, I know it can get pretty hairy, Marilyn, right? In labor and delivery. And if you don't have that communication, you don't have the trust. So how are you guys empowering patients to speak up and to be their own advocate?
I think, as everyone else has said, I think we can only say the same thing. It's communication. It's letting the patients know that you have the time to listen to them. We teach all of our nursing staff communication skills so that they go in and they sit with the patient. They don't just walk in and say, I've got time, as they're running out the door. You know, it's all of those skills that you learn on patient engagement. And I think that that's probably the biggest way that we work with our patients to make sure that they have the opportunity, if they have concerns, to bring them forward about not feeling that they are getting the kind of care that they need.
And we also, as nurse managers and assistant nurse managers, we round on our patients as well. And we want them to be able to, you know, we go in and see how they're doing and, you know, ask the questions. Is there anything that we can do for them? You know, I'll give them my information. So if the patient, you know, maybe doesn't have a question right then and there, but during their stay, they can reach out to us and give us a call, or maybe they have a question when they go home. So I think, as Valerie said, it's really important to start that conversation when they first come in with the nurses and, or, you know, whether it be the provider or, you know, our leadership team as well. We want to make sure that it's open for whatever they need, you know, before, during, and even after. We have a lot of patients that, especially during COVID, that will call us with questions regarding whether it be visitation or just their experience through the hospital. And we make sure that we take the time, and if whatever patient, whether it be through email or through phone, we make sure they have a contact information before we get off that phone call. And they may be newly pregnant. And you know, I have people that will call me throughout the whole pregnancy, and I'm more than willing to and help them, you know, guide them through.
Thank you. Dr. Gittens-Williams?
So in addition to promoting the Hear Her campaign throughout for our patients and throughout the organization, we also make sure that all our patients, as they come for prenatal care and as they leave the hospital, we're strongly encouraging them to have MyChart, which is our patient portal, so they can see sometimes before, as soon as they've delivered, they can see that their postpartum appointment has already been scheduled. Sometimes they ask, do I have to come tomorrow? We say, no, it's not tomorrow. You have to stay in the hospital for 24 to 48 hours, and that appointment is in for 2 to 3 weeks. But they can see all of this on their patient portal, and we encourage them to use that to Dr. Contreras' point, we're living in the digital age with our digital moms and our digital babies, and we really do have to take advantage of those opportunities. We're also reviewing during the prenatal care, we're reviewing a birth plan, using a template where we're finding out about their requirements or their need, whether they want an epidural, whether they want to participate in our early recovery for cesarean section program, if they're scheduled cesarean section. Will they take blood? And we discuss induction of labor, what it is, what it might mean, and what if they have to have one, so they're prepared for this eventuality. We also assess who's going to be with them in labor, so that if they come in the middle of the day and the person whose name they said would be there is not there, they can tell us, oh, he's at work, but my mom is coming. And we encourage them to bring their partner or whoever their designated person is into that space, which also can improve their outcome. And then lastly, I would say that, it's the partnership and the relationships that we all have. I mean, I know many of the other participants on this platform for other reasons, and the partnership and other organizations have brought us all together. But I think as we train the next generation of doctors to communicate and to work in partnership, we can get best practices from one another. We can share stories. We can pick up the phone when I find that one of my patients has been, at another member hospital, the night before for emergency care, with her permission, we can, contact those people at that organization and get enough information to give the patient good care. So I think that as we continue the partnership and our own relationships, that also improves patient outcomes. So I'm pretty grateful for that. Thank you.
Absolutely. Well said, and a nice way to end our conversation. Thank you so much for being our very first guest in Partnership Live, or Partnership Live episodes, and really having a robust discussion, not only about Maternal Health Awareness Day, week, month, but everything that you're doing in the community to ensure that the patients are safe and educated and empowered on a daily basis. Thank you very much for helping us change the maternal child landscape. And thank you for joining us for our first episode, our first of many episodes of Partnership Live. Please join us for our partnership events that we're having for Maternal Health Awareness Week. On January 21st, we have our Patterson Doula Kickoff, the Patterson Doula Cooperative, which is called a Community of Caring. So we look forward to you being there. And please join us for our extra special session on January 27th for administrators to express employee burnout and maternal health. So visit our website, which is www.pmch.org, and click virtual events. I look forward to seeing you during our next session, and thank you so much.
Thank you.
Thank you.